Hello, I would like to present our new teaching innovative development and delivery of concept map in clinical education. And we designed the delivery of this teaching series by using CAN step curriculum development. The driving motivation for this approach is that patients seek medical assessment with a problem and not necessarily a diagnosis. The teaching has therefore been arranged around the defined presenting problem. Secondly, there are exploration of identifiable disease in the last 2 decades, and we haven't had sufficient working memory to save all the common symptoms and signs of all of these diseases. However, 200 diseases cause only 31 common symptoms. That's why we changed it to symptom-to-diagnosis approach. So we do the target need assessment. The students know about individual conditions like asthma, myocardial infarct, bowel obstruction, but they used to struggle with cognitive process by which shortness of breath, chest pain, and abdominal pain were synthesized, integrated with their knowledge and experience, and used to diagnose, to elaborate, and to find the best matches to manage the patient problem. Moreover, the students do not want lecture on the diseases or conditions that they can get easily from the textbook and online, but they would like to have a same learning objective focusing on the case. Due to the COVID situation, the students have significantly less exposure in clinical area. When there is a limited exposure, we still have to provide them with some learning events which reflect similar bedside case-based discussion. So our goal for the students are not to memorize this concept map because none of them could be perfect and different clinicians can create their concept map differently. Our ultimate goal for them is to learn about the disease, learn what they present with, match the two, read some symptom-to-diagnosis book to create their own one. However, this concept map series will help students to understand what the concept map is, how it looks like, and how they learn the process of diagnosis reasoning through this concept map. We are using the principle of constructed alignment, whereby the intended learning outcome for a course are mirrored in learning activities. The intended learning outcome for newly qualifying doctors here are not to recall a number of facts, but rather to mobilize and apply those facts to solve new problems. So the learning activity should aid discussion of comparing and contrasting of the given resources. The concept map is by definition a visual organizer that can enrich students' understanding of a new concept. We aim to deliver a series of 50 concept maps on a common presenting complaint by end of 2021. 30 concept map presentations have been produced 7 months into this project. They are then circulated on Moodle and on this project's dedicated YouTube channel. Each concept map explores one presenting complaint, identify the key groups of differentia, and provide a visual demonstration of the thought process that help distinguish those differentia from one another. It acts as a scaffold to organize the knowledge of individual disease condition that's providing a systematic and functional way to approach patients. Concept maps are created by authors, comprised mainly of the junior doctors, and extensively reviewed by senior clinicians relating to their field of specialty. Here are some examples of the maps we have created so far. Questionnaires are released to our first clinical year CP1. We are asking series of questions, 52 responses so far, and 100% of them agree and strongly agree to the following statements. Here are the comments from the responders. Overall, this delivery of concept map in clinical education was extremely well received by the students, by the clinical teachers, and then by the junior doctors who developed them. And this can be borne out by the positive feedback received from them verbally and on the evaluation form. I would like to thank all my colleagues who involved in creating the map, who use this map in their teaching, and who review our maps and IT help. Thank you.